A sore throat is usually a sign that something bigger is about to strike, and while viruses cause the majority of sore throats, bacterial infections and allergies can as well. In most cases, a sore throat will improve with an at-home treatment. Some things you might try: gargling with warm water and salt, drinking warm liquids that feel soothing like hot tea with honey or soup broth, using a cool mist humidifier to add moisture to the air, cooling your throat with a popsicle, sucking on hard candy or a lozenge. However, it's time to see your doctor if that sore throat becomes severe, is accompanied by a fever of over 101 degrees, and lasts longer than 2 days. The specialists at Lake, Ear, Nose, Throat and Facial Plastic Surgery talked to us about how they searched for and treat the cause of a sore throat.
If somebody is having a sore throat, generally you'll look for other systemic issues such as a fever, chills, sweats, how long it's been going on, and on exam looking at their throat, is there evidence of pus in the throat, tonsil inflammation, is the back wall red, and there can be some cobblestoning, which is a clinical term we use that suggests postnasal drainage, and then looking down at the throat either with an indirect exam with a mirror or with a flexible endoscope to look at the voice box and see if there's some redness or swelling, or if there's any lesions or problems with the actual vocal cords. Some common throat conditions we see are from allergies, postnasal drainage, acid reflux, swallowing problems, voice issues from either or all of the above. Regarding the nose and the sinuses, that's a very frequent problem area in Florida with allergies. So most folks have some underlying seasonal or year-round problems with inflammation, congestion, runny nose, and then sinus pressure, recurrent sinus infections. People with throat infections may be more ill with fever, chills, sore throat, more trouble swallowing, breathing sometimes.
Frequent infections is the main thing. An adult that gets 4 or 5 episodes of strep throat or severe sore throat per year, and having to miss work and just the pain and suffering associated with those infections, then it usually is worth considering tonsillectomy just to get rid of that type of medical problem. We also see kids that have a lot of tonsil problems, and they can manifest in several different ways, including sore throats and strep throats, which occur very frequently. But also children can have enlarged tonsils, and that can cause a variety of other problems, including snoring and sleep disordered breathing, which includes sleep apnea. And that's actually where a child actually stops breathing for 10 or 15 seconds at a time and almost has to wake themselves up to continue breathing.
Tonsillectomies are generally an indication in children that have recurrent strep throat, generally 6 to 7 a year, or if they have recurrent episodes about for 3 years and on that timeline. And also if they have evidence of sleep apnea or symptoms consistent with sleep apnea, adenoid tonsillectomy is recommended. In adults, you're usually a little more conservative with recommending, but generally if they also are a candidate from a standpoint of sleep apnea, recurrent tonsil infections, or if there's some concerning pathology, if one tonsil is bigger than the other and they're a smoker or have some other risk factor, you'd want to take the tonsil out.
For more information on this story, as well as links to the specialists at Lake, Ear, Nose, Throat and Facial Plastic Surgery, just click on the Sore Throat Solved story link on our homepage at yourhometownhealth.com.